Good evening, everyone. I would like to present my research work on assessing the knowledge of nurses on the infection control practice on hand hygiene, the basics of infection control, nurses' knowledge on hand hygiene, and the individual and organizational predictors. So, why is infection control so important? It's because of the fact that the patient, insurers, governments, and regulatory bodies are much concerned on the impact of associated infections. It's not only most of these are preventable, but also put lots of pressure in terms of associated morbidity, mortality, and cost of treatment. So, do we as healthcare members play any role um in the preventing infection? So, yeah, I think nurses and other healthcare members play a vital role in patient care delivery. So, it's imperative that they are updated with information pertaining to hand hygiene and other infection control measures. This study will aim in determining the nurses' knowledge on hand hygiene and the individual and organizational predictors. Sign of this research work is as follows, like that this descriptive and cross-sectional study was conducted in Lifecare Hospital Abu Dhabi, UAE. The participants surveyed in this study were 150 nurses who were invited by a census sampling method. A questionnaire was prepared which was reviewed for its validity and reliability before provided to participants. So, in the introduction, our modern healthcare delivery system is complex, and hospital-acquired infection is one of the most expensive preventable thing. So, the current trend of healthcare is much complicated by healthcare-associated infections, the increasing severity along with complexity of disease and its treatment, and imposed by multi-drug resistant pathogen infections. This has resulted in the healthcare practitioners' view on the infection control and prevention measures. Ample scientific data suggests that hand hygiene, even though very simple, non-time consuming, cost effective, can significantly decrease the risk of infection spread in the hospital. 14 lakhs suffer from hospital-acquired infections. It's estimated that 40% and more are preventable hospital-acquired infections in developing nations. This is an underlying the impact of hospital-acquired infections that the carriage of MRSA and fall in MRSA rates are noted with an increase in hand washing compliance. Low acceptance of protocols among healthcare personnel leads to a high prevalence of nosocomial infection in critical areas. This highlights the role of nurses and hygiene predictors. Malcolm et al., in a study about hand hygiene among healthcare staff, notes that nurses' knowledge about standard precautions is not enough, and many of them believed that by wearing gloves there is no need for washing hands. This makes it vital research to assess the knowledge of nurses on hand hygiene. The methods which were used, I decided to choose a descriptive and cross-sectional design conducted in inpatient department and critical care area. The study sample consisted on 150 employed nurses in the above departments, like in the critical and in the IP. Census sampling method was used for inviting participants. A questionnaire based on a wide range of internationally approved guidelines was used as the knowledge assessment tool. So the results are, I'll share with you. Among participants, those who were employed in critical care unit was 61.1%, and 134 nurses, which is about 89.3%, were in rotation shifts, and 10.7% out of 16 nurses of them were working in fixed shifts. Those who were not participating in previous educational courses about hand hygiene were 15.9%. In addition, among educated nurses who participated in 1 to 3 previous educational courses were 55.5%, 20% of them participated into 3 to 5 previous educational courses. Results are about 68 of participants reported a need for continuing education regarding hand hygiene. The mean score of nurses' knowledge was 10.39. In the percentage of nurses who obtained low Moderate and high levels of knowledge were 1.9%, 29.9%, and 68.1% respectively. After the study, the results are put up for discussion, and the highlights are: an important finding of this study is that the nurses were lacking in the basic principles of hand hygiene guidelines and its practices. This stressed the importance of education and training needs of the nurses in terms of basic principles of infection control and hand hygiene. One important result that was concurred at the end of this study was the statistical relationship between training classes and knowledge about hand hygiene. It was required. That literally means that the educational and training programs conducted to improve the nurses' knowledge had no effect in this regard. Continuing in discussion point, it was also found that increase in number of years of work experience directly influence the knowledge level. Important predictors of nurse knowledge about hand hygiene, which have work experience and previous training. The definition of hygiene was because of the various differences in hospital policies, educational methods, and other conditions involving the wards. The following articles were used as references for research tool and for the validation. You can see the references on the screen. While discussing the conclusions, I'll let you know that the bottom line of this study was that the knowledge of nurses on general hand hygiene practices was high. On the other hand, they fall under non-acceptable level of knowledge category on the basic principles, and it related to hand hygiene and its definition. Multivariate analysis revealed that the factors such as work experience and previous training history act as important predictor of nurses' knowledge about hand hygiene. Um, in the study also found out that the current educational method followed in the hospital is not effective and needs to improve the teaching strategies and introduce innovative and interesting methods of learning and teaching. This was supported by a finding of the study, which 68% of study population reported a need for better continuing education in the same regard. Limitations of the study was two main limitations were there. The population was purely female. The area where the study conducted was busy, and the involvement of the nurses in answering the questions were not in controlled environment. Suggestions were that can be made from the studies that the nurses should improve their current knowledge and their attitude toward the guidelines and patient safety via innovative trainings which are to be conducted by the hospital based on the nurses' need. My idea. Thank you very much.